Welcome to EnVision Center News. Today's episode is about Bonner Partners in Care with Clinic Director Chryl McCarty and SPIN Coordinator Jackie Carter. We hope you enjoy.
Welcome, Chryl. Today I have the privilege of talking with Chryl McCarty, the Clinic Director for the Bonner Partners in Care. We're so glad you're here today.
Thanks for having me.
I have some questions to ask you today, and so we're going to get started. Chryl, can you tell us about yourself and what brought you to this area?
Sure. I worked at Mercy Redding in California, Northern California. It was part of the Dignity Health System. I was with them for 30 years. I was actually born in that hospital, worked in that hospital for 30 years. I was a transcriptionist for 10 of those years. In the last 20, I was able to manage that hospital as well as the other two North State hospitals. Mercy Redding, there was Mount Shasta, and there was St. Elizabeth. So I managed a whole bunch of girls and the outside services until concurrent coding and voice recognition took over, and there went my job. And my husband had just finished teaching. He was a high school teacher, finished at a continuation high school. He taught for 37 years. So at about that time, we'd visited here a few times, really loved it, and thought, well, we might as well. We're untethered, we might as well go. So then that's how we ended up here. And just settled in and just absolutely love it in October of 17.
Oh, well, thank you for sharing your story. What a great story to know you were born at the same hospital that you worked in for so many years. Well, welcome to Sandpoint.
Thank you. It's beautiful.
So you're the clinic director for the Bonner Partners in Care Clinic. What led you to work for them?
You know, I was working at behavioral health at the hospital for a while. And I just really love that demographic, folks who could use a little assistance. My son also has schizophrenia, so we maneuvered a lot of systems for him, helped him for 13 years. And then Julie, my supervisor, she knew that I was looking for something part-time, and this job happened to come open. And so it was right up my alley, helping folks find the services they needed. And so I applied, and here I am. I love it.
Oh, that's so good to hear, and how fortunate they are to have you.
Thank you.
So Bonner Partners in Care Clinic opened for patients in 2003. What is the clinic's vision, and who do you serve?
Yeah, we serve the folks who do not have health insurance here in Sandpoint and the outlying communities. Folks who also have very high deductibles that make health care unmanageable for them are also welcome. It's just whoever comes, no questions asked.
Oh, good to know. Is there a fee for the clinic services?
No fee at all. It's totally free. We used to do a sliding scale. That was years past, and now it's just come in and be served. And we'll do what we can.
What amazing service for our community.
Yeah,
wow.
It is nice. It is nice.
By providing basic health care to the uninsured of Bonner County, Bonner Partners in Care Clinic helps improve the overall health, vitality, and economic climate of North Idaho. The benefits to the community are long-term and widespread. Please tell us about these benefits.
Yeah, it's really nice that we get to do our part. All of the nonprofits in the area are very interdependent, and I'm very grateful and happy that we can play our part in filling some gaps as far as enhancing the health care of children and their families, and therefore not duplicating or creating competition for the existing health services. And also helping folks reduce the hardships, both financially and physically, for people who avoid medical care until it becomes a catastrophe. That thereby alleviates the health delivery system from having a bottleneck. So emergency room visits could be prevented by folks if they could have management of their chronic illness. It also helps with the economic climate in the area. The community is able to have one of their largest issues addressed as far as helping folks with no insurance get the health care. It also helps the lower income households remain sustainable. They can manage their bills and not become overwhelmed by enormous medical costs, which in turn helps the taxpayers, reduces their costs to them as far as the health care. And as far as our volunteers, they're able to get out of the house and continue providing service and reaching out to our community.
Wow, what an important service to our community that Bonner Partners
in Care is.
Yeah. Is Bonner Partners in Care currently seeing patients in the clinic?
We are. The first year of COVID, we did do telehealth, and then that went by the wayside in that patients preferred to come in. I noticed our attendance declined, so we're trying to ramp that back up with a lot of advertising. We do have a couple of physicians who may opt to do telehealth depending on their schedule, as well patients if they're very, very ill, for example, with COVID. We do ask that they do telehealth as well.
Good to know. Cheryl, the clinic is operated on a first-come, first-served basis, and you provide services for up to 8 patients per clinic night. What are the days and hours that the clinic operates?
We are only open on Tuesday evenings. Lineup can start anywhere between 5:15 and 5:30. It was alternating every other Tuesday, Thursday, but that turned out to be kind of hard to remember as far as advertising. We send more of a consistent message by keeping it only on Tuesday evenings. We hope to get back up to 2 evenings a week, which in the past we were up to 2. So I'm hoping that we can grow to that again.
Oh, awesome. Are there any services you do not offer?
We don't do broken bones or stitches, family health care, STD, family planning, dental care, vision exams. We do everything else, though. We do the cold flu symptoms, treat chronic conditions, help with the medications, do specialists referrals, help with radiology studies as well, and help. We shoulder most of the costs for those.
Great, thank you. Are there any additional services you offer?
We do. We have free health screenings offered through the Panhandle Health District. That's where we're located. They are available the first Tuesday of every month, and they're able to do the free health screenings either before or after you're seen at Partners in Care, or even if you don't want to be seen at Partners in Care. And if they do find an issue with a patient, they will refer them to us so we can help them or refer them on to a specialist.
Wow, what a great partnership.
It's really nice, yeah.
So where are you located?
We are at the Panhandle Health Building, 2101 Pine Street in Sandpoint.
Can you be contacted by phone?
Absolutely. Our clinic number is a cell phone that I have with me 24/7,
Wow.
208-255-9099.
Well, thanks for sharing that with us. So at the clinic, you rely on your staff of skilled volunteers to make your services available to the community. If someone is interested in volunteering at the clinic, how would they find out about volunteer opportunities and the requirements and how to sign up?
There's just a couple of options there. They can call me or go to our website, Bonner Partners in Care. And there's also a volunteer application on our website. They can fill that out, scan it back to me and email it, or they can snail mail it, and then I can call them. We'll contact and see what they want to do. If it's an administrative, clerking, anyone can do that. But if they want to be a provider or a nurse, of course, they have to have a current license.
Okay. How can we, as the Community Resource and Vision Center, collaborate with you to get the word out to our community about your great services?
Well, this podcast is a wonderful start, and also you will graciously have us on your website with all of that information, and just keep spreading the word to folks when they come in to see you and hand out our pamphlets. That would be great.
Okay, we'll do that.
Thank you.
Do you ever work with other nonprofits?
We do. We have recently a collaboration between us, Bonner Partners in Care, and the Bonner Community Food Bank, as well as the Better Together Animal Alliance. We are putting together what's called One Health Clinics. We recently had our first one in Priest Lake. Our second one is coming up on November 17th. It's at our fairgrounds here in Sandpoint from 9 to 12. Better Together Animal Alliance will see your pets, your dogs, and your cats, free microchipping, free dog food, free health care services for the animals. And then we have the food bank handing out free food. And then, of course, Partners in Care is there to do free health screenings and to identify folks who need to be referred on. And we also have, for folks identified, for example, with hypertension, we have blood pressure cuffs that they can take home to continue monitoring. So this will be our second one coming up, and we're really excited about the collaboration between all three of us.
I'm excited for you. I'll make sure that we get the word out on it.
Yes, thank you.
Well, is there anything else that you can share with us today that maybe we didn't cover in these questions?
It just if folks could just share with their friends, find the demographic that doesn't have health insurance, and send them our way. That would be really appreciated.
Great. Thank you so much, Cheryl, for taking the time out of your busy schedule. I know you're in clinic tonight, so we thank you for coming in, and hopefully we'll talk soon.
Thank you for having me.
You're welcome.
Thanks for listening to today's episode. For more information, you can go to CRECidaho.com. Please like, share, and subscribe. We will see you again soon.